Individuals with Parkinson's can present with a whole range of communication problems associated with the disease. And I know we're all familiar with the quiet speech, the hypophonia that's often associated with Parkinson's, but I want to talk about palilalia or festinating speech. And as that name indicates, it's an analog to the festinating gait, the steps that get smaller and faster until the person loses control and has a balance problem or a fall. And in the context of speech, it is much the same thing. You'll have an individual who may be able to start the beginning of a phrase and then gets a little faster and harder to control, and they get a little out of control, and eventually they trail off. The palilalia can be somewhat difficult to treat. It's not something that is particularly amenable to simply having someone stop and restart. And as a matter of fact, you might have them in your office and you're trying to get them to be more intelligible. You say, "Oh, wait, stop. I need you to start again." If you find someone in that environment, do a little quick test. Just have them count from 1 to 10 and see how long they can progress. Can they go 1, 2, 3, 4, 5, 6, all the way through there? Or do you find them going 1, 2, 3, 4, 5, 6, and then 1, 2, 3, 4? That's a classic palilalia presentation. And then you want to refer them to a speech therapist, and we can start to implement some different techniques. And one of them would be to use a pacing board. And that's simply some squares on a sheet. We probably have it on a stable environment, but I'm here in the camera. So, you would have them talking while they're using this tactile control. And we would start very slow, maybe even like one syllable at a time, but at some point you want to progress that into a little more natural speech. Now, when I was directing my network of interdisciplinary teams back in Colorado, we had a wonderful student named Chris Smithwick who's still out there practicing up in Wyoming. And he came up with a wonderful idea of putting one of these boards. It does work better if you have the colored squares. And he made a little wristband for this gentleman who was presenting with camptocormia, was in a wheelchair, and often his gaze would be a little bit lower. So this was a nice way to do this. And it became a nice, elegant presentation that the guy could use anywhere. It was always ready for him. And again, having a little bit of tactile cue coming from the finger, also to wherever he was touching, in this case his wrist, it was a nice way to handle that. The final solution that I might use in a situation like that is like the delayed auditory feedback. And there are dedicated devices that are available for that you can get as like a durable medical equipment. But there are a number of apps that can be tried. And this is all great reasons to refer these individuals to a speech language pathologist with expertise in treating Parkinson's so that we can use our bag of tricks and help them come to a solution so they can communicate better and have better day-to-day interactions with their friends and their family and their community. I'm John Dean. I'm the chair of the Allied Health Professionals Special Interest Group, and I'm a speech language pathologist in private practice.